Thank you, everyone, for another amazing topic of conversation. I want to thank our sponsors, the Health Channel. Please sign up for the Health Channel's newsletter and stay up to date. And also, welcome our new sponsor, Finkelman's, where you can pamper yourself with tools for your inner chef and more. And thank you to the I Remember Against Genocide bracelet, teaching people not to hate. So, Dr. Galit, thank you so much for joining me.
Thank you for having me.
This is really an amazing, I am really honored that you're here. We did, when the pandemic first started, we talked to Joel from Sheba, and he told us everything that Sheba Medical Center was doing in Israel. And for everyone that doesn't know, Sheba is one of the oldest medical facility in Israel. It's a public hospital, so everybody can go in, and it's run only by donations. So whoever wants to donate, please go ahead. So Dr. Galit, I wanted to talk to you because I heard about the Sheba Beyond program and I thought it was fascinating. And I wanted to share with everyone what you're doing.
Actually, you're right. Our project or our hospital began in the beginning of COVID-19. So we were doing. I'm a physician. I used to run the pediatric infectious disease unit. I was a clinician, and we were thinking already about telemedicine or bringing Sheba's care to the homes of our patients using technology.
But this was before the pandemic, right?
Yes. Okay. But before the pandemic, we had many difficulties in operating such programs. There were regulatory problems, and people didn't use Zoom or telemedicine, and it was really we were able to develop only a few projects. But when COVID-19 came, we did a rapid transformation, and we transformed very quickly many of our outpatient clinics to video clinics. And moreover, we use new technologies to treat inpatients. And the experience we gained during the beginning of the COVID-19, when we treated inpatients with telemedicine tools in order to decrease physical contact between clinicians and patients, taught us a lot about how we already have good technologies and we can now scale them. So after the first wave, we decided in Sheba to establish a new hospital. Sheba is a medical center. It's a comprehensive medical center with 4 hospitals. And we decided to establish a new hospital, which we named Sheba Beyond, that would bring all of our services to the houses of our patients. So we have developed several services, including in women's health, internal medicine, rehabilitation services, outpatient clinics, psychiatric services of home hospitalization as well. And we have right now quite a wide range of services that we provide, both through telemedicine to patients in their homes. We're able through technologies and with the backbone of Sheba's clinicians to take care of these patients. So we have, as I said, hospitalization, rehabilitation, and outpatient clinics, a very wide range of services.
So you have a wide range of services, but explain to us exactly, for example, the pregnant women that I know that you told offline, you told me about how you're treating pregnant women without them having to go to a doctor's visit.
So the development of the technologies allow us nowadays to decrease the need of these patients to come to the hospital every time they had to before, especially pregnancies with high risk who need to perform ultrasound or monitor the babies every now and then. So nowadays we have Israeli technologies that allow us to do both monitoring of the heart rate of the baby and both to do a self-performed ultrasound guided by the physician from afar in their houses. So we used these technologies in the beginning in the COVID-19 wards, and now we've finished pilots in the homes of our patients. And we already used them, for example, when we went to build a field hospital in Ukraine, and we needed women there to be examined by our Israeli doctors.
So you take a sonogram, and how do you send the images?
So everything is online. It's sent by the internet that you have to download an application. That the ultrasound, for example, is connected to your phone. And whenever you do that, your phone connects it to the clinician that's in Israel or in his clinic or wherever he is or she is.
So he can see the ultrasound and you can see if everything is okay.
Yes, exactly.
That's amazing.
Yes, and of course we use other technologies as well, but even in these programs, we use our telemedicine platform that allows us both to connect by video and also to monitor vital signs, to create specific programs for specific patients, and to treat them as they should be treated personally. So it's a personalized healthcare system.
So let's go back when you were talking about the field hospital in Ukraine.
Okay,
what's going on there? What are you guys doing? And
as soon as the war broke in February 2022 in Ukraine, Israel could not send weapons because of our situation, but we could send healthcare services. Israel has very good healthcare services, and usually the country of Israel sends a field hospital that's led by the army. But this time it's a war zone, so they could not do that. And they decided to send a civilian field hospital. And because Sheba is the only hospital in Israel that has created the infrastructure for a field hospital, has developed a field hospital during the last years, we were chosen to lead this mission. So it included clinicians from all of Israel's healthcare system, but it was led by Sheba. And as soon as I heard that we're sending a field hospital, I just knew that Sheba Beyond had to be there and send its technology there in order to be able to actually change the paradigm of how humanitarian aid is given. I said, if we could bring through technology all of Israeli specialists to the field, that would increase the level of services that we can provide to the patients in Ukraine. And that's exactly what we did. We had a fully digitalized field hospital. It's intense, but inside everything is computerized, digitalized, our health records, our labs, our x-rays. And because we created it as a part of Sheba, whenever patients came there and they needed a consultation, all the information was visible to Sheba's clinician here in Sheba. And they can give very high quality consultations.
So you were able to treat patients of war, surgeries and everything guided also.
So we didn't do surgeries there. We didn't do surgeries there. We operated in a local hospital. We did do surgeries, but not in the field hospital. But whenever we needed a specialist consultation, we could get top consultants from Sheba online, seeing all the medical records, all the information, and of course, talking to the patient and examining the patients from afar using technology as well.
That's amazing. Talk to me about COVID. I know that we started the conversation and this was how Sheba Beyond was born and move forward. But what happens now? How do you see COVID? I know you're a pediatrician. What happens with the children? Vaccines?
So I have to say, the children are not the biggest problem in COVID. So the biggest problem in COVID is the elderly, the people with underlying diseases that are sicker and suffer more from COVID-19. Children usually get it less severely than adults. But anyway, I believe, you know, what we learned during COVID-19 that we cannot foresee the future. I don't know what will gonna happen, what is going to happen. But I do know, I suppose we're going to have more waves of COVID-19. We'll have a little bit more, a little bit less. Vaccines obviously did part of the job, not enough. But we do have in our arsenal now new drugs for COVID-19 that can make it easier for patients with severe disease that we use a lot. By the way, Sheba Beyond treats a lot of COVID-19 patients in their houses, in home hospitalization. It's one of our best services. So we provide these drugs, of course. So I believe we will continue to see waves of COVID-19, but it will be more and more like a flu illness. So we have to return to our normal lives and learn how to live side by side with COVID-19 and do whatever we can to decrease the risk of acquiring, and then if we can, treat the disease with the drugs that we have right now.
So it would be like with the flu, like a yearly booster.
I believe that it will be a yearly booster, yes.
A yearly booster, and will it protect from all the variants? Because
I don't know. I don't know. We don't know.
We have a million variants.
But I do believe that, you know, as we go on year by year and we get exposed to more and more variants, we boost our immune system in several ways. So each time we're boosted in a way that may cause the next variant to be less severe. So I do hope that it will be like a flu-like disease. You know, flu is a complicated disease in elderly and sick people. You have to get a vaccine because people die from the flu and have severe illness. I mean, once flu is a severe disease, it's already been spread so much that all of us have already met the flu once. But flu is a severe disease as well.
Beyond what you're now doing,
beyond,
what else is it now? What are you looking into?
So we're looking to increase the way we can treat people at home. We're always looking for new technologies that will help us give more value to our patients at home, so that patient cannot come, don't have to come to the hospital. Our major aim is to prevent these people coming to the hospital and still receiving the best care they can receive. So we're developing more services in more fields with more technology, and we're working with the regulators, with the policymakers, to allow us get reimbursed for these programs, to be able to do these programs, and also combine them with at-home services. So nowadays we're able not only to do things from distance with technology, but also to send nurses to the houses of our patients, x-rays and imaging studies. And this way we can provide more services in the homes of our patients. So my vision is that in a few years, less patients will be hospitalized in internal wards, and about 20–30% of them can stay at home and still receive the same kind of treatment, and only very severely affected patients will be here. Complicated surgeries, ICU, those are the patients that will be in the hospital.
How do you do the x-rays?
Oh, we have a portable machine.
We have a portable
machine, yeah.
So you just send somebody to the home and then you do exactly like the same with the sonogram.
Exactly.
But you still need to draw blood physically.
Yes, we do, but with the advancing technologies, we need less blood. It will be capillary in a few years, and no need to take it back to the laboratory. We can do it on site. So we're always looking for new technologies that will make it simpler, so that we won't have to send very qualified personnel to the houses of our patients, to make it more effective and cheaper as well.
That is really amazing. Tell me a little bit about Sheba. What a little bit of history for those that don't know how Sheba was born. What's the hospital? How can they donate?
So Sheba is actually was established at 1948. The year the Israeli state was established by Professor Chaim Sheba, a physician, and it was in the beginning a military hospital. But soon it grew and grew and grew, and nowadays it's in Ramat Gan next to Tel Aviv. It's not only the largest hospital in Israel, but it's also been on the list of the top 10 hospitals by Newsweek for 4 years in a row already. And that's because, excuse me?
The 10th most, the best 10 hospitals in the world.
In the world. It's the only Israeli hospital in this list. It's also been on the list of, I think on the 13th place as the smartest hospital. So a lot of this because of the high level clinical care, but also because it has a lot of research, it has a lot of technology, it is a very big wing of innovation named ARC service. And actually Sheba, as I said before, is a tertiary medical center which included 4 hospitals: a general hospital, a rehabilitation hospital, including psychiatric wards, a pediatric hospital, Safran's hospital, where I worked before, and a OBGYN hospital, women's hospital. And this is a very large campus with a lot of students, a lot of physicians and workers, and we have 1,900 beds in Sheba.
1,900 beds, and how many employees? Because it's like
9,000.
9,000.
Yes, 9,000 workers. And
How
growing. Changes every day.
And growing, because now you not only employ doctors, but now technology became a huge part of Sheba.
Exactly, and Sheba has a vision of becoming a city of health, interacting with the community, with all what the community and the areas around have to offer: education, even roads, and and everything that the community has to allow. We interact with this, and we're saying we're not a true hospital, a house for sick people. We're a city of health, and we have a lot of companies collaborating with us, both high-tech companies, drug companies, pharmaceutical companies, educational operations, and others.
Can you tell us a little bit about how you do? I know that we touched on the Ukraine field hospital, but also I know that Sheba goes to any emergency around the world in literally hours.
Exactly. So we have established this infrastructure that allows us to send humanitarian teams to wherever is needed. So, for example, we go to Africa where there's an outbreak of measles. We go to all kinds of places where we are needed. Even during COVID-19, we sent a team to Italy to help treat COVID-19 patients. But mostly we go to, disaster areas when they have disasters, and then we help the local teams to treat the people that are needed to be treated.
Like earthquakes, floods,
exactly,
and all that.
Exactly. Floodings, earthquakes, and sometimes even outbreaks of diseases, for example, cholera in Africa, measles in I don't remember what kind of islands, but it was a few years ago. So yes, Samoa Island, I think. So we're saying either severe outbreaks or disasters like floodings, earthquakes.
We have an outbreak now in the US of polio.
So I know. Yeah, well, we also had. So this, it's complicated, but it's because some of the people don't receive vaccines. And I don't know if I should get now into the explanation between an inactivated vaccine, a killed vaccine, and a live attenuated vaccines. But in places where they didn't have polio, they stopped giving the live vaccine. And sometimes it helps, sometimes it causes us to continue to transmit the virus if you're infected with it. So we need to boost our vaccination.
For polio.
Excuse me?
For polio.
Yeah, for polio as well. Polio is a virus, yes.
So you're totally transforming now the live vaccine.
No, so we were giving in the United States for more years now. They were giving only the inactivated, the killed vaccine. And in Israel a few years ago, because we found live polio viruses in the sewage, we started giving the live vaccine as well to prevent spread of this virus. And we started giving it now, but we have pockets of communities that are not getting vaccinated, and that's the problem. These pockets of people that do not get vaccinated. We had that in Jerusalem, we had that in southern Israel at the last time. So, and that's where the outbreaks begin.
And how do you avoid that?
So we do extra effort to, yeah, we have to doing an extra effort to vaccinate these kids, to talk. Sometimes it's religious people, so we have to talk to their, leaders to influence them to go to get vaccinated. And sometimes we actually send, people to vaccinate the kids in the communities. So the Ministry of Health does that at the moment. And also increase awareness, in all of the public.
Education.
Education.
The bottom line, education.
Exactly.
Dr. Galit, thank you so much for this. This was very interesting. And please, everyone who wants to help, it's Sheba Medical Center. And till the next time, and above all, stay safe. Thank you, everyone.
Stay safe.